Welcome to The Explainer. Today, we're diving into the world of trauma to see what happens when a critical organ gets injured. And you'll see how one tiny, elegant anatomical detail completely changes the story, the diagnosis, and, well, everything.
Okay, so let's just jump right in with a simple but pretty serious question. An injury like this can happen to anyone, but what actually happens inside your body when the bladder tears?
First things first, what are we even talking about? A bladder rupture is basically just a tear in the bladder's wall. And that tear lets urine leak out from where it's supposed to be. Now, the fancy medical term for this leak is extravasation. And where that urine goes, well, that's the most important part of our story today.
To really get why there are two totally different kinds of rupture, we have to look at a crucial piece of anatomy that acts like a dividing line. It's called the peritoneum. Okay, check this out. Imagine the bladder is a water balloon. The peritoneum is like a thin plastic bag. But here's the twist. It's only pulled over the very top half of that balloon. The sides and the bottom of the bladder are actually outside of this bag. And that single detail, that's the key to everything. And to believe it or not, that one fact, the exact location of this peritoneal bag, is why we split all bladder ruptures into two completely separate categories. It all comes down to whether the tear happens on a part of the bladder that's covered by the bag or not. So, here's the bottom line. If the tear is on the sides or the bottom of the bladder, the urine leaks outside the peritoneal bag, just into the space around it in the pelvis. We call that an extraperitoneal rupture. But if the tear is on the dome, the urine leaks inside that bag, pouring directly into the main abdominal cavity, and that's an intraperitoneal rupture. So now that we know about inside the bag versus outside the bag, let's follow the story and see how that one little detail leads to completely different causes, risks, and outcomes for the patient. It's really two very different stories.
First off, which one happens more often? Well, you can see here that tears outside the peritoneum, the extraperitoneal kind, are way more common. They make up about 70% of all bladder ruptures. And that makes sense, right? Since most of the bladder's surface is outside that peritoneal covering to begin with.
And get this, their causes are totally different too. Extraperitoneal ruptures are almost always caused by a pelvic fracture, where a sharp piece of broken bone literally pokes a hole in the bladder. Intraperitoneal ruptures, on the other hand, they're the classic result of a direct blow, like a kick or a hard fall, right onto a full stretched-out bladder, which then bursts at its weakest point, the dome. And I'm not kidding, the link between those extraperitoneal ruptures and pelvic fractures is incredibly strong. Over 90% of these injuries happen right alongside a broken pelvis. In the emergency room, they practically go hand in hand. And this is where you really see the difference in the danger level. With an extraperitoneal leak, the urine is contained in the pelvic space. Now, that can cause a serious infection or a deep abscess, for sure. But for an intraperitoneal leak, the urine fills the entire abdominal cavity, and that can lead to a widespread, life-threatening infection of the abdominal lining called peritonitis. Now, no matter which type it might be, when a doctor suspects a bladder injury, they're usually on the lookout for this classic trio of symptoms: pain low down in the abdomen, not being able to urinate, and, the biggest giveaway, blood in the urine, which is known as hematuria. So, the doctor has their suspicions, but with two very different possibilities, how do they find the proof? How do they know for sure which leak they're dealing with? Well, they have a really effective way of seeing the leak with their own eyes. The go-to tool for this is a procedure called a retrograde cystography. It sounds complicated, but the idea is simple. A special dye that shows up really well on x-rays is carefully put into the bladder. If there's a tear anywhere, that dye is going to leak out, and a CT scan will show exactly where it's going. And what doctors see on the scan is just night and day. There is no mistaking it. For an extraperitoneal rupture, the dye creates this very distinct flame-shaped pattern that stays contained within the pelvis. But for an intraperitoneal rupture, the picture is completely different. You see the dye flowing freely all around the intestines, outlining every single loop and turn of the bowel. Right, so once you have that crystal clear visual diagnosis, the paths to recovery are also completely different. But they make perfect sense, because the treatment is tailored exactly to the type of leak. For the much more common extraperitoneal rupture, where the leak is contained, the treatment is actually, surprisingly simple most of the time. A catheter is used to drain the bladder and just keep it empty. This gives the tear a chance to heal all on its own, usually in about 10 days. But for an intraperitoneal rupture, with all that urine in the abdomen, that's a whole different ballgame. That requires urgent surgery to wash everything out and carefully repair the tear in the bladder